With changes to vaccine recommendations coming at the federal level, many health and political leaders in the Northeast continue a push to keep them available. That includes officials at Vermont's health department who say depending on the outcome of a CDC meeting in 10 days, they might stop following the agency's vaccine guidelines. ABC 22's Matt Holderman joins us now live in the newsroom to talk more about this situation and the position Vermont has decided to take.
Thanks, Lauren. Yeah, vaccine recommendations and really the CDC as a whole have changed a lot in recent months under President Trump's Health and Human Services Secretary Robert F. Kennedy Jr. There's been extra scrutiny, though, given to the latest COVID-19 shot specifically. And with RFK appointees speaking against it, local health leaders could trek a path of their own.
This isn't new for us, but the confusion and the changing recommendations, that is new.
Meredith Plumpton is the director of the Vermont Department of Health's immunization program, which contracts with the CDC to purchase vaccines and distribute them to healthcare providers around the state. She says the last few months haven't been business as usual with the federal agency, as a lot of staff has been replaced under Secretary Robert F. Kennedy Jr., staff that has differing views from the previous one when it comes to vaccinations. Recently, the CDC shared new recommendations on COVID-19 vaccines specifically, saying it should only be given to people ages 65 and older or people who have medical conditions that put them at higher risk. Amid the turmoil, COVID shots are harder to find or purchase in Vermont than they used to be.
Right now, the only place in Vermont that you can get a COVID vaccine is a pharmacy. And national pharmacy chains are going by that guidance, and we're hearing anecdotally that a lot of the pharmacies are requiring a prescription.
As the federal changes unfold, health officials like Plumpton are awaiting a meeting of the CDC's new Advisory Committee on Immunization Practices, or ACIP, a week and a half from now. The results of that meeting could be newer, even more conservative vaccine recommendations, which Plumpton says could cause Vermont to make some changes as well, loosening some ties with the CDC.
We'll decide at that point if we're going to continue to follow ACIP recommendations or follow some national medical professional organizations' recommendations. In Vermont, we want to make sure that COVID vaccines continue to be accessible for anybody who wants them.
Even if the Department of Health stops taking recommendations from the CDC, they still can purchase vaccines from them. Now, Vermont health officials are also meeting with others around the Northeast to talk about immunization and problem solve how they can get around barriers to vaccine access that might pop up in the future. Reporting live in the newsroom, Matt Holderman, ABC 22 News.
And Matt, in the Empire State, CVS says it will provide the vaccine without a prescription. CVS has added New York to a list of nearly 40 states where state pharmacy laws allow the company to offer it. Governor Kathy Hochul signed an executive order Friday allowing pharmacists to give the jab to New Yorkers ages 3 and up. Steve Moore, a pharmacist at Condo Pharmacy in Plattsburgh, says her order does provide more clarity.
She authorized pharmacists, whether it be through a standing order with a physician or nurse practitioner, or even she authorized pharmacists to write orders, patient-specific orders on our own, to make sure that patients who are interested in the COVID vaccine are able to receive the COVID vaccine this year.
For those wanting to get a shot, Moore encourages people to be patient and recommends scheduling appointments in advance. CVS says those in Vermont and New Hampshire can also get the vaccine without a doctor's signature.